Let's explore anxiety from an integrative psychiatry perspective. In addition to this presentation, please check out the blog linked in the description, and there you'll also find a downloadable document that provides some interventions to consider from an integrative psychiatry perspective. Anxiety is the mind and body's anticipatory response to uncertainty, perceived threat, or lack of control, marked by a persistent sense of unease, tension, and hypervigilance that becomes disconnected from immediate danger. It is the suffering of what might happen, not what is happening, a looping internal narrative that magnifies doubt, catastrophizes possibility, and hijacks presence. Anxiety is like a smoke alarm that keeps going off even when there's no fire. Two symptom clusters can be divided by the two main branches of the peripheral nervous system. The first is the sympathetic nervous system. This is involved in mobilization for danger, the get up and go system. The second is the parasympathetic nervous system, involved in shutdown and immobilization. Oftentimes, these two clusters overlap and a mix of symptoms is present. Sympathetic nervous system symptoms are all hallmarked by overdrive and can be captured by the acronym PANICS. This includes palpitations, abdominal pain or cramping, nausea and altered gastrointestinal motility, for instance diarrhea or constipation, intense fear of death or losing control, among other things, chest tightness and difficulty breathing, and sweating. Parasympathetic nervous system symptoms are hallmarked by underdrive and can be captured well by the acronym MISERABLE. This includes muscle tension, irritability, sleep impairment, energy decrease, restlessness, and attention impairment. Before screening and evaluation, it's important to differentiate anxiety from other potentially more appropriate descriptors. Fear is a response to a known immediate threat. Stress is tied to specific demands or pressures, often external. Excitement manifests with similar physiology, but it feels energizing and positive. But this should be further differentiated from mania. Hypervigilance refers to heightened activity of the threat monitoring system in the context of ongoing lack of perceived safety. This may occur in trauma as well as anxiety. The psychiatric differential diagnosis, meaning conditions that appear similar to anxiety, can be captured well by the acronym ONSTAGE. Obsessive-compulsive disorders are hallmarked by fixation on patterned thoughts and behaviors. In normal life changes, this form of anxiety is related to life adjustments and transitions. In somatoform conditions, there's a theme of physical symptom presence and concern. Anxiety with contextual features consistent with trauma often points to a traumatic etiology. This is very commonly at the core of anxiety. Attributable anxiety is related to a specific theme. For instance, social anxiety, phobias, depression, ADHD, psychosis, and personality conditions. Generalized experiences with anxiety are often pervasive with no specific theme. Episodic anxiety involves intermittent experiences such as panic, but should be differentiated from mania. The use of screening tools depends on what content is associated with the syndromal features. So the appropriate screening tool depends on whether the condition looks like generalized anxiety disorder, panic disorder, obsessive-compulsive disorder, bipolar disorder, or PTSD, among other things. Just looking at the DSM criteria for anxiety disorders, there are over 1,000 unique combinations of symptoms. 60 to 80%, or 600 to 800, of these symptom combinations that can be used to diagnose DSM-based anxiety disorders also occurs in other conditions. Therefore, the majority of these symptoms used to describe anxiety do not uniquely point to an anxiety disorder. Simplifying our diagnostic understanding of anxiety to a functional definition, like the one provided in the previous slide, while capturing a more refined set of neurobiologically informed symptoms and expanding our consideration of the interactions between the body and the brain, significantly improves our understanding and ability to treat anxiety effectively. Integrative psychiatry goes beyond these diagnostic constructs to evaluate the underlying causes and contributing factors. There are three main areas that we consider: psychological and neurological factors, biological factors, and lifestyle or environmental factors. Anxiety is experienced as changes in the way threats are perceived. It involves a dynamic interplay of the threat detection system, subcortical activation, autonomic nervous system activation, the cortico-striato-thalamo-cortical loop, or CSTC loop, and the hypothalamic pituitary adrenal, or HPA axis. The threat detection system utilizes the senses and the brain's capacity to monitor the internal and external environment for threat. Subcortical activation refers to the activation of lower brain regions, including the amygdala and network projections. This system can overwhelm the capacity of the executive brain, the prefrontal cortex, to manage threat. The autonomic nervous system includes the two main pathways described in the previous slide, the sympathetic and parasympathetic branches and their activities. The CSTC loop is what carries the stressor beyond the actual stressful encounter. This is the worry or obsession loop. Often with activation of this loop, generalized avoidance or repetitive behaviors called compulsions may be part of the experience. The HPA axis aims to provide the energy to maintain this carried response, but at the expense of adrenal fatigue and augmentation of the parasympathetic nervous system symptoms. Oftentimes, trauma underlies experiences of anxiety. Trauma is, by nature, disconnection from the self, which leads to fragmentation. This sets the stage for a nervous system that has difficulty finding its way home to safety and regulation. On this stage, there may be a sense that you're an actor, wearing various masks that don't feel right, relating to the experience of anxiety. This may partially explain some of the significant overlap and confusion about the symptoms of anxiety and its various forms captured by the ONSTAGE acronym. Some of the biological factors include the following. The adrenal glands carry the stressor beyond the stressor through cortisol, which normally mobilizes energy, but at the cost of making the anxiety experience persistent. In terms of hormones, some estrogen metabolites are anxiety-producing and may not be adequately cleared or detoxified from the body. Progesterone usually balances this out in healthy concentrations. Testosterone provokes underlying neurobiological changes. In terms of the gut, there's a bidirectional relationship owing to the chemical similarities between the brain and the enteric nervous system. Often anxiety and gut disturbances, especially irritable bowel syndrome, coincide. Bacterial or fungal overgrowth, among other changes, contribute to anxiety. With the thyroid, even subclinical elevations in thyroid hormone can contribute to anxiety symptoms. In the territory of the immune system, Immune dysregulation and low-grade inflammation influence the balance of neurotransmitters, contributing to anxiety. Deficiencies in B-complex, iron, magnesium, zinc, and vitamin D all contribute to anxiety. These are important cofactors for neurotransmitter synthesis. Some genetic abnormalities, for example COMT, can negatively impact stress resilience and contribute to anxiety. These can be epigenetically modified through diet, supplements, and lifestyle changes. Lifestyle and environmental factors include the following: anxiety related to social settings, relationships, work, and illness, among other things, commonly stems from underlying trauma. Impaired metabolic activity and related imbalances in carbohydrate, fat, and protein concentrations all influence anxiety. A common culprit is high sugar intake and the blood glucose variability it causes. A sedentary lifestyle or lack of exercise contributes to anxiety. The resulting deconditioning can be unconsciously interpreted by your brain, specifically the insula, as a threat, leading to anxiety symptoms. Impaired sleep quantity and quality creates a circadian rhythm imbalance, throwing off the normal balance of neurohormonal activities. In terms of substance use, what goes up must come down, what goes down must come back up. Anything stimulating may directly contribute to anxiety, and withdrawal from sedating substances like opioids, alcohol, and so on may contribute to anxiety in the withdrawal period. Casting a wide net and looking at the whole person and their experiences helps to develop a tailored, personalized plan of care. There is likely not just one root cause, rather it's a constellation of factors that contributes to the experiences such as anxiety. In the treatment of anxiety, a combination of treatments is likely to yield positive results, and this combination depends on the individual's experiences. Some main categories that we look at include medications, nutraceuticals, the body, lifestyle, and therapy. Medications for anxiety may include the following: selective serotonin reuptake inhibitors, or SSRIs, serotonin norepinephrine reuptake inhibitors, or SNRIs, tricyclic antidepressants, TCAs, and adjunctive agents such as buspirone, and as-needed medications like propranolol, hydroxyzine, clonidine, and benzodiazepines. In terms of nutraceutical options, the most appropriate option depends on your specific experience, but may include 5-HTP, ashwagandha, lavender oil capsules, L-theanine, inositol, and St. John's wort, among others. A focused exploration into the impact of the adrenal glands may indicate a need for a regimen to calm the stress response. This is often achieved through the use of adaptogens like ashwagandha. Targeting biological derangements with adrenal support, hormone support, gut evaluation and treatment, thyroid supplementation, immune support, B12 or folate supplementation, iron, magnesium, zinc, and vitamin D can reduce anxiety symptoms. Sometimes a multi-ingredient formula such as Empower Plus or Daily Essential Nutrients may also be beneficial. These considerations are typically based on comprehensive evaluation and tailored to the individual. The plan of care for a given issue, for instance gut problems, may vary from person to person depending on findings. In terms of habits, reducing and eliminating substance use and other addictions may be a key consideration. Addiction is typically a solution to a deeper underlying problem. Oftentimes protective measures to avoid anxiety are in place, but this paradoxically worsens the symptomatic experience. With sleep, stabilization of sleep routines and patterns, through things like reducing blue light exposure, avoiding stimulating activity before bed, etc., with a goal of 6 to 7 hours of sleep per night, is helpful in balancing the circadian rhythm. Moderate intensity exercise improves anxiety and stress symptoms. Exercise can actually rewire one of the key areas of the brain, the insula, responsible for internal threat monitoring, and can therefore be used as a type of exposure therapy. Dietary adjustments such as sugar reduction to less than 10% added sugar, and other modifications based on gut and nutritional evaluation can make significant differences, especially for those with overlapping anxiety and gut symptoms. A goal of therapy is to establish a sense of safety while exploring the alarm system, identifying areas where we can adjust the alarm to go off at appropriate times. This involves depth work to explore the nature of triggers and heal any deeper-rooted issues, while countering anxiety with relaxation and safety. You can't be anxious in a relaxed body. Thank you for listening to this presentation. See the link below in the description for the blog, where you'll find some helpful downloadable content as well.